Hi there, this is Dr. Faye Snyder again. Today we're going to give you some background on the causes of behavior, starting with the most fundamental cause of all causes, which is attachment. Attachment is the ability or the action of connection between parent and child. It references the quality of that connection. It is so important because with a failed attachment, an adult will live the rest of their lives at risk of other trauma. For example, soldiers at war who come back with PTSD tend to have had more failed attachments than those that didn't come back with PTSD. So the worst type of trauma is attachment trauma, and it is so serious that it alone, failed attachment alone, can create a killer. There are two ways that we measure an attachment. One is by quality of attachment or attunement, and the other is by continuity of attachment, which would mean that if there are attachment breaks, then the quality of the attachment is probably changed forever, and it's almost as if there was never an attachment to begin with, because once you fail in that attachment, once you create an attachment break, the child decides to never trust you again. They don't want to get close again. They push away. They don't want to make eye contact. They don't want to be too intimate, too close. There's two ways to fail an attachment. One is acute and one is chronic. So if parents decide to go on a vacation on a 1-year-old for 2 weeks and come back, that would be an acute attachment break. Or let's say the mother goes into the hospital or the baby goes into the hospital. Those are acute attachment breaks. There's a difference between the child who never had an attachment and a child who had an attachment break. The child who never had an attachment is not as sharp, not as intelligent, and the child who had an attachment but broke off is more intelligent. The other type of attachment break is a chronic attachment break, and those are the ones that take place day in and day out, putting, for example, a baby in daycare 5 days a week. That would be a chronic attachment break. Alright, so if a child is securely attached, they will be resilient and conversational and warm and empathic and funny and communicative, and like a lot of the commentators on television that look so healthy with themselves, those are people that appear to have secure attachments. An insecure attachment looks quite differently. The insecure attachment has 3 different types. One is called avoidant, and it creates an adult that turns out to be rather cold and shallow in their meaningful relationships. And then there's an ambivalent attachment, which creates an adult that tends to be hot and conflicted in their relationships. And there is the disorganized attachment, which causes an adult who has rather crazy thinking. We don't understand how they could think that way. It's caused by a needy yet fearful relationship with a parent. Age of attachment failure is critical. The first year is the most critical of all. And there are important ingredients in a failed attachment in the first year, which we need to talk about. They create the foundations of schizophrenias and autism. And so I invite you to continue on to the next video, where we will talk about failed attachments in the first year and how they can create autism and the foundation of schizophrenia. See you there.